will invite Mr. Henry Chukwu to do a big presentation for us that will provide a context for our discussion. Thank you.
All right. Hello, good afternoon, ladies and gentlemen. So I know that this kind of presentation is usually quite difficult, especially when you're done eating by this time, right? But I would want to seek your attention. This is going to be very brief, but quite instructive. So I'll be taking you through a presentation. The subject is on effective social safety net. And at the end of this session, we should be able to have some sort of visibility around what it takes to build an effective social safety net. So I think we should start with, when we talk about an effective social safety net, what do we want to achieve? And I guess you would agree with me that what we want to see, the real change we want to see, is not just about protecting households from shocks, right? But we want to build the capacity of the household to build the long-term resilience of this household and also long-term prosperity. That is what we make a social safety net, a social safety program effective, right? I guess you agree with me with that. But there's one thing, I think there's one big sad news or sad reality for Nigeria. The truth is that most of the households in Nigeria, they are just a shock away from sliding into poverty. And this shock could come in form of economic shock. It could be, shock from climate-related issue. Somebody mentioned about health today that you could have one ailment and the person is gone in terms of the finances, and the household will slide into poverty. There's also issues around insecurity. People get displaced as well. So these are different challenges that people face that could actually lead or push most households into poverty. But the truth is that majority or most of our social protection programs, they are fragmented, right? So they are designed to help at a moment, right? But after that, if there's some sort of, it does not create long-term resilience. So you create, maybe you want to give this an eventuality, you decide to do some sort of cash transfer. And there's maybe another eventuality comes and people get displaced. And what happens is that because there's no integrated system that overlay multiple intervention, people tend to slide back into poverty. So we're going to spend some time to be discussing about this today. Next slide. I think this is some sort of a sad statistics for us, right? And most of the speakers that have spoken today have always referenced this data. In Nigeria, based on the 2022 multi-dimensional poverty index, we have over about 103 million Nigerians that are poor. That is over 62% of our population. This is a sad news, right? And when we talk about poor people, the poor people, they are not evenly distributed across Nigeria. So you see disparity, both at a regional level, there's disparity even at the state level. Kids are also affected as well. So poverty is not just about people not having money. Poverty is connected, it's tied to nutrition, it's tied to education, it's tied to housing, and so on. But the big picture here, or the key message we want to pass, is that when you're designing an effective social safety net, you need to leverage data. You need to design a program that could actually address, identify where these poor people are and address and get them within, try to build their resilience and solve their problem, right? When Patrick was speaking earlier today, he mentioned that how can you have about 133 million people that are poor, but you're designing a social safety program that is for 8,000 people, right? So it's not inclusive, it's fragmented. So this is what the key message. So when designing an effective social safety net, you have to consider data. Data, it has to be evidence-driven. Next slide. So why does graduation model matter, right? So we have discussed about this, mentioned in previous slide about fragmented social protection interventions, right? Sometimes, most times, these single interventions don't create long-term resilience. So for instance, you have different interventions. Let's say that you want to probably provide assets, right? To poor household. You provide assets to poor household, but what happens is that in most cases, extreme poor households tend to sell off this asset to meet their basic needs, right? So it's not sustainable. It just gets it at the moment and it fizzles. And before you know it, people also fall back into poverty. Or let's say that you want to provide some sort of basic need. Overall, it's improved the consumption of the family, of the household, but it does not really empower the earning capacity of those households. They just take it at the moment, improve their consumption, but they cannot generate enough funds to ensure that that intervention is sustainable. The last one is that let's say that you want to provide some sort of capacity and coaching for most of these households to set up a business. So in most cases, you provide these interventions, trainings, and coaching, but without access to credit or access to capital and access to even start up this business, most households don't start up the business. So it's not sustainable. So why does graduation model work? It's a multidimensional big push that integrates both asset support and coaching. It puts everything together to create a long-term resilience for most of the household. And you look at this brief theory of change, right? You integrate these different interventions together, offer it to household. About after 2 years, what do you see? There's improved basic needs. Households have access to, basic meal. It leads to an outcome of active livelihood. The same thing when you talk about financial inclusion as well. So when you do this implement graduation model, it leads to financial inclusion at the immediate term because the household will have access to save, they have access to even lend to and also borrow as well, and which leads to an outcome of social empowerment. But overall, this approach leads to a long-term pathway out of extreme poverty and resilience. And it's not, next slide, please. So graduation model is actually not just a theory. It's something that works. It's something that has been implemented in different markets. There have been a lot of up to 22 RCTs that have actually been conducted in 15 countries that prove that graduation model actually works. A classical example of this is the Bangladesh case, right? Where BRAC implemented graduation model in 2002, and since then, BRAC has actually scaled this graduation model and have actually graduated about 2.1 million households. So this is a track BRAC maintain actually over 20 years of longitudinal data that identify to prove that graduation model actually work, right? And what are we seeing? Not just that within the span of 10 years, you can see some sort of a steady upward mobility in terms of general improvement in the welfare and resilience of most of these households. And it's not just from BRAC, right? Other researchers have also conducted some sort of evaluation to prove that this graduation model actually works. And the example of that is London School of Economics that also implemented an impact evaluation to prove that this model actually works. So the story is not just about Bangladesh. We also have our own little story here in Nigeria. The National Social Safety Program implemented some sort of pilot, an abridged version of graduation, where it was delivered in up to 6 states, couple of 12, about, I can see it properly, but couple of local government households, about 8,000 households were targeted. These households received transfers, they also received some sort of savings mobilization and other interventions. And what are some of the results that we saw? There's improvement in the earning capacity of these households. Most of these households were able to also employ people or individuals outside the household. So the overall depression, anxiety, all of that reduced significantly. So this also shows that this graduation model actually works. Next slide. So, but when designing an effective social safety program, context actually matter, right? So you don't need to, there's no one size fits all, right? So you need to understand your terrain, your market, understand what really works. But whatever thing when you're designing, you must ensure that the program is politically supportable, is administratively feasible, and is also technically sound, right? Some countries host these social intervention program in one ministry, some spread across various ministries. Some also partner with development agencies to implement social intervention programs. But the key point here is adaptation. Identify what works for you within your context, within the country, within the market, and design an effective social safety program. So how do we design, build an integrated approach for an effective social safety program? So this is actually built on a three different strategies, three different layers, right? Factors or systems that should be considered. One is that it has to be evidence-driven. It has to be data-driven. You leverage the multidimensional poverty data. You leverage an integrated and solid registry as well. It has to be shock responsive as well. And overall, the graduation model integrated with enterprise pathway where you combine both asset training, healthcare, coaching all together to lead to be able to build something that will lead to long-term resilience. So this is what we should keep in mind when developing an effective social safety program. Next slide. So when we talk about an effective social safety program, we shouldn't also see it that this is the work of the government. I think it's the work of everybody. It requires concerted effort. Government has a role to play, development partners as well, the private sector. And one key message here is that private sector or private business leaders shouldn't see supporting social intervention program as a cost. They should see it as an investment. Because let's assume that you implement an effective social safety program and you're able to pull these 133 million people out of poverty. Automatically, these 133 million poor people automatically becomes future consumers, right? They could also support in the value chain as well, and they become millions of customers for service industry, for instance, the banks and so on, even other sectors as well. So it's very important for us to, for private sector to consider supporting social intervention programs, to know that this is an investment to the future, an investment that could also impact the profitability of the market. So every ₦1 invested today is a future, you're investing to future profitability of the market. Next slide. So closing out, I'm going to leave some thought-provoking questions that I hope that we should be able to discuss further during the panel conversation to help us answer these questions. So the first one is around design. How do we ensure that the safety net are not a standalone intervention, a standalone scheme, but an integrated system that leverage data, that is shock responsive and also enterprise linked? The second point is around the implementation. How do we balance speed and quality, meeting urgent need while also embedding long-term resilience? And the final one, and this is something we have been discussing today, right, about co-creation, the community resilience. How do we get the community into the part of the process of designing most of this intervention? How can we get women? How can we get farmers, the youth, so that this resilience, the outcome of this social program will be co-owned? So the resilience is not imposed on them, rather is co-owned. So I will pause here and I will look forward to having conversation and for us to see how we can unpack some of those points. Thank you.
I know we just finished eating, but please, another round of applause for him. Thank you so much. So without wasting our time, we'll just move straight to the panel discussion. But I'm actually happy with his conversation about empowering local communities. It's not just us sitting here to have that conversation, but empowerment in terms of ensuring that they are trained, ensure that they have access to funding. So it's not just about giving transfer, but ensure that the community members are actually empowered, to be able to drive the conversation. But the other thing he mentioned is about adaptability. So we have to find a way to fit it into our context. And as God will have it, we'll have panelists who are very conversant with this conversation. But let me start with Mr. Henry. Maybe I'll just invite him back here to sit on the panel. Mr. Henry is the Associate Director of Policy at Innovation for Policy Action. Joining him is no other person but Engineer Omar Bindri. He's the Chief Operating Officer, Bindri Knowledge Center. Finally is Mr. Mohammed Diko Bala. He's the National Coordinator, Head of the National Social Registry. A round of applause. Thank you. And then my name is Ndidi Anyanwu. I'm a Research and Policy Manager with Next Year. Thank you. I know it's an all-male panel, but all right, just a quick one. You discussed the Bangladesh graduation model, and then you talked about contextualizing it. It has to be fitted into our own context. If you can just generally go back to that, what exactly does that mean for us? If you're going to adopt that, what exactly do we need in order to get that to effectively work?
All right, thank you so much. So I think this is a very simple question, right? And which I guess is somewhat a little bit relatable about adaptation, right? Understanding what really works within your market. So Bangladesh is not Nigeria, right? So they have their demographic, some of the factors that could, make things work within their system, or some certain things that is quite unique to Bangladesh and the environment as well, and also some other actors that could support the implementation of this program. But coming back to Nigeria as well, we need to understand what really works. Who are the stakeholders? What are the challenges? What are the issues that could inhibit the success of any social protection program, right? And find a way, consider all of these factors from the standpoint, from the design stage, right? So ensure that we have connection with the right stakeholders, we have considered some of these factors, and design something that really fits and works for us, right? It's about ownership. It's about tailoring the initiative or tailoring the program to meet our need within considering our local context.
Yeah, because, the initial panel talked about insecurity, climate shock, and issues around that, which you also mentioned. Given our own context, given the issues we address, especially in terms of insecurity, maybe because I work in that space, if this will really work, because the communities where you're supposed to implement this are also being challenged with these issues. How exactly, just to think around that.
Great. I know when I was speaking, I also mentioned that insecurity is also one of the shocks that could push people into poverty, households into poverty. This could lead to displacement and all of that. So designing and implementing social intervention program or social safety net within community, I think first you have to consider the security situation and also carry local stakeholders along, right? From the standpoint of, from the design stage, let them be part of that. Let them understand what really works, get the buy-in as well. Because sometimes when we talk about security, it's also a little bit localized. You cannot even get this, you may not be able to even get, let's say, an external security agent to support. So you need to get into the community and understand that what really works, understand the security architecture of the locals and not really relying on police, for instance. Police or the national security will definitely play a role, but understanding security architecture of the community is very important, and those has to be considered from the point of design.
Let me go back to Engineer Binduri. I know you in the morning when Professor Chidi was speaking, you asked him to get back to you. I know you worked across, you've been in this space for a long time, policy implementation and the whole of that. But I just want to understand from you, why is it that anti-poverty programs in Nigeria often stop when an administration ends? That's the end of an administration is more or less like the end of that program. Why do you think that's that?
Thank you very much. First, thank you for inviting me. Second, I think I'm a bad person to be here because I've gone through all this in big circles. But I'll share my experiences based on your question. Look, first, poverty, the kind of poverty we're talking about, is absolute poverty. It's shameful. It's demeaning. And therefore, eradicating it must be the agenda. Anybody that says that absolute poverty cannot be eradicated doesn't like you. Why? Because absolute poverty is about not drinking clean water. So you're always left with waterborne diseases. Absolute poverty is about not eating good food. Therefore, you're always malnourished and low in nutrition. Absolute poverty is about delivering in a very difficult situation, possibly ending up with maternal mortality, child mortality, which is shameful and disastrous, and so on and so forth. I mean, there's no reason why all Nigerians cannot beat their chest and say every child must have access to primary education. This is my definition of poverty, and it is eradicatable. But Nigeria keeps on going in circles. Why? Because actually we love this poverty. Because if we didn't like it, all our policies, don't say that it's just poverty alleviation policy. There is nothing like poverty alleviation policy. The policy on developing your food security and agriculture is poverty alleviation policy. Your industrialization policy is poverty alleviation policy. All policies. Therefore, we must learn from people who have managed to solve this type of poverty and sustain it. And what do? First is that their policy is evidence-based. There is massive data. All the policies are interrelated. They digest them. They make sure that they are practical, understood by the nationals, and so on and so forth. This is not what we do. We like going to Singapore, like you see all these examples. We pick industrialization policy of Singapore, and anywhere you have Singapore, you just put Nigeria there. And then you submit your report, beautiful policy, totally non-Nigerian and unimplementable. We must stop this. Secondly, in all the countries that have managed to minimize or eradicate this kind of poverty and sustain it, they have respect for their institutions. They respect and guard their universities, their polytechnics, their colleges of education, their research, because that is where the knowledge is coming from. What do? Nigeria can close their universities for 1 year. Nothing changes. There is no way you can get rid of poverty when you have that kind of culture. So we must understand that our professors are good and we depend on them. The PhDs are good. The labs are working. The workshops are working. The lawyers, everybody must be very good. Otherwise, we continue. We have 300 universities, nearly 600 polytechnics and monotechnics, and we have absolute poverty at 40 to 60%. It's ridiculous. Number 3, these countries operate what we call as national systems of innovation. All institutions partner, cooperate, linkages, and synergize, so that even when you have Director General in Lagos and another Director General in Yobe making presentations, their slides should be the same, to show you that everybody is talking to each other. But what do? We like compartmentalize it. We like islands. This is my money. This is my vehicle. This is my office. Don't come through my gate. Nonsense, and so on and so forth. You will never eradicate poverty if we continue this culture. Number 4, countries that have managed to do this is that even if they don't have raw materials, they get raw materials from other countries. But if they have raw materials, they make sure that they add value to it. That is where the jobs are. That is when you are arrogantly showcasing knowledge. That is where the processes are. How come that we can take our crude out? and then import finished product. And if we don't get enough, we abuse our leaders. How come that we're just not adding value anywhere? It's a showcase that our 300 universities are not working. So we have to change that. And then finally, we discussed about you must prioritize your area of development. You cannot take everything everywhere. Nowadays, I hear young people and even the middle-aged people and older people talking about AI all over the place. AI is about massive, credible data. Nigeria doesn't believe in data. In fact, if you're collecting data about institutions, people think you are an anti-corruption agent. You want to check their shortages. You want to know everything. They will not give you information. AI will not work for you. Soon, you will put all the AI and then you say you are expecting AI to model somebody from Adamawa State. It will give you an Indian because you don't have the data. It will use other data and then give you the results. That is how it's going to. So now, if we prioritize, then this poverty elevation must have a mentor. There must be a mentor who will say that poverty, absolute poverty in Nigeria is not acceptable. Who should this mentor be? The president himself. The president must beat their chest and say, I am not going to allow absolute poverty in my country. And he will lead it. He will knock every door. He will make all universities work. He will make institutions partner. He will make ministers to be talking to each other. But without that, it is going to be impossible. I have many points, as you can imagine, but I better stop here. Otherwise, this man will have abuse.
Sorry, before I go to Mr. Diko, there's been conversation around legislating the National Safety Program. What are your thoughts around that? I mean, Engineer Bindu. If we are to legislate, there have been conversations around having some sort of policy or legislation to, safeguard, institutionalize the social safety net program, so that even if there is a transition or a change in government, it's still like there is a policy guiding it. What do you think about?
Well, if you pick from my last, you see, there is nothing like policy in just this tiny little safety net. Is just an acronym that is used by World Bank and all these international bits and pieces. There's nothing like safety net. It should be a tarpaulin. You fall, you bounce back. Safety net will carry you there.
Yeah.
And you remain there. If you're not careful to lift you, it's another challenge. So institutionalizing it, everything we do in poverty alleviation has to be cultural. You must believe that this is good. You are prepared to use your life to defend it. Your mother losing her life because of delivery should not be acceptable. So all these legal documents or policies and so on and so forth is just trying to break things into bits for crisis. And that is why when you formalize all these documents, every government that comes, because the poverty is actually the politics. Have you not heard that anybody who wants to do campaign is vote for me, I'll give you water. Vote for me, I'll give you rice. Vote. This is embarrassing. But once you attack this, then the political language has to change. Because it is not changing, anybody who comes after you will know what you have done and then start all over again because we failed. So to me, institutionalize or not institutionalize is an impact thing. If poverty is coming down, you don't need to tell people that, poverty has gone down by 15%. You will just see it. You will see us, affording to ride keke napep easily. You will see us going to restaurant. It's only 100 naira for rice and shaki. You will see us drinking water. We will see less traffic to the clinic. There's nothing like you come here and you say, I'm the Minister of National Planning or Minister of Health or whatever. Oh, look at us, we are making progress. But in reality, the whole thing is under tension. So legalized, institutionalized, it is the impact that will talk to you. And any good thing will be sustained. Bad things is what people will challenge, unfortunately.
Maybe I'll go to Mr. Bala before I come back to the room. There have been lots of conversation around data, working with different institutions. There are various data sources out there. There are various points or organizations now that collect data. I know there have been, your ministry has done a lot in terms of upscaling registration and all that, but it's still largely domiciled, I could be wrong, within your ministry now. I just want to understand what it has been in terms of collating or working with these different institutions? And how do we now ensure that your registry is also adapted? So it's not just is able to respond to early warning, is able to respond to climate shocks, is able to respond to security issues like I asked him earlier, and it's also inclusive, that you're having both the marginalized groups, women, youth, and all that embedded there.
Well, thank you very much, and it's nice to have me here. Well, I think I will start with the National Social Register, which is a database of poor and vulnerable households. And as it is today, we have about over 19.8 million households, which translate to over 71 million individuals. And then the coverage is in the 36 states and FCT. And we're in about 774 or 771 local government, 771. That is scientifically, but logically, we're in all the 774. I will shed light on that later. But when we started in 2016, it was just a project term NAPS project, and it was designed only to answer 2 million cash transfer. That was the initial in 2016. And the systems were developed. We used the geographical targeting because we have limitation in terms of coverage. We have to cover 24 states. So we have to do the geographical targeting to start from the derived state using poverty mapping, and then the community-based targeting, where the community now define what is poverty within the context of their community, and then set out the criteria of who is poor, and then go ahead to identify and name those people that are poor in that community. The process and the product of that CBT process is what we call the harmonized list. And it's the harmonized list that the enumerators now will take and move from house to house. Initially, they were using paper-based, but as we move in 2018, we started using CAPI, computer-based interview, and we have about 138 variables that they are collecting in each of the households, divided into two, at the household level and then at the individual level. So these enumerators will now collect the data, and the data syncs direct to the servers. And that's where the cleaning process starts at the state level, and then it moves to the national level. At the national level, the data is cleaned, and then it will now be added after certifying all our authentication processes, both at the state level and the federal level. And the data is added to the national level, and a mirror image is sent to the state. So the National Social Register is an aggregation of all the 36 states and FCT's register. It's a mirror image. So then we just identified who they are and what they are, where they are, quite all right. But there are limitations because it is just designed to fit the federal government cash transfer. But later on, other programs start mining. As I'm talking to you, about 13 programs are mining and utilizing the register. Over 21 state-based programs are utilizing the register. But it is not enough because there are criticism along the line that comes up. Okay, who are those people? Who are those people that are benefiting? Who are the beneficiaries? But this is basically because people cannot distinguish between the National Social Register as a planning tool and those registers, beneficiary registers, that programs come to mind based on their criteria. I told you earlier, the National Social Register was to serve the cash transfer. And the criteria for cash transfer is based on decile, 1 to 10. And you are mined if you fall between decile 1 to 10. So proximity is not a targeting mechanism, but rather a criteria for selecting who will benefit in the federal government cash transfer. And as I am talking to you, we have scaled up to NAPS SU, and the coverage has increased from 2 million of the NAPS to now, from 2 million, and then the design was 10.2, but the federal government have scaled it to 15 million households. So the question is, you can't ask me sitting here that who are the beneficiaries or who got paid or who did not get paid. Because we have two PIUs, because they come with their criteria, mine, go back and make the payment. So the responsibility is response on those who are mining. I do the tracking to monitor what are you using the data for. But you have your own eligibility criteria and what have you. And then what we do now is to expand the scope of the register, to remove the rigidity clause of just one targeting mechanism to multidimensional targeting mechanisms, which include, integrating secondary data. All these redundant beneficiary registers around the MDAs, NGOs, and what have you. We have developed a data integration protocol where we can integrate them, because your MDA stands to benefit. If you keep your data, it is only your program that, and your beneficiaries that will benefit from your program. But when you bring the data to the center, to the National Social Register, there are other possible programs that may come to mind, and your beneficiaries stand the chances of maybe selection in other programs. So we are advocating for, one, a more coordinated and centralized, base for the National Social Register, not at, where there will be a convening power like before, like the Vice President's office. And then, it's because I'm sorry to say, but this is the fact. If you leave it in one-sided ministry, you can't, a minister, sorry to say, may not have the convening power to summon other ministers and say, okay, come. I have a meeting today on the National Social Register. You should come, because of their conflicting, schedules. They may not have this. But if it is in a well-coordinated and then central location, where there is, like it used to be before, in the Vice President's office, it will be, easier for the Vice President or his representative to summon, whoever he wants for a meeting, so that, and then even policies, they will be easier to be implemented and say, okay, now that the register has been, updated with NIN, the households have been updated with coordinates. Now we are having an integrity added to the register. So we are now rolling out a policy that will say every intervention we need from state, local government should mine from the register, because we know who we are paying. We know where the values are going. There is NIN, there is coordinates, and there is account numbers. It's digitalized, and then, you can track easily. So these policies can help in, reaching out, and then designing our programs, we should be adaptive. Adaptive in the sense that, we just have to look at the social protection aspect. We just have to look at, okay, the risks and disaster management. We need to do the risks mapping. What are the risks? What are the disasters that are happening around the country? And where are they happening? And what are the impacts of those, disasters and then the risks? So that we can now design programs tailored toward, all these risks that are happening. You cannot start thinking of hurricane or whatever in Nigeria. Mostly we know is flood. And where are the flood-prone areas? Where are the communities? How many of the poorest of the poor that are in the fraud communities that are in the register? And how many of them are benefiting from the cash transfers? And yes, if we check, yes, there are, then what are the gaps? And what are these needs For some in the flood-prone areas, it's just information. You tell him tomorrow there will be flood. He has the ability and the power to pay for his family because he has another house in the state capital he can move. But even there are some that even if you tell them that there will be flood, they need support to move their family out of that area. So we have to now, it's interagency, interministerial collaboration. Not for us to hold on and say, okay, NEMA, everything disaster is NEMA. I don't want anybody to do, we have to have an integrated, the data need to be speaking to each other. Interoperability among MDAs and agencies is very important. Thank you very much.
Sorry, I know we've exhausted our time, but just one question, if you can respond to that in maybe 1 minute. You said the conversation is should be advocating for an integrated, centralized safety net register that states and local government, even CSOs, every other person can mirror from. Just 1 minute. In 1 minute, if we are to go for that, what will be what should that look like? If you're to recommend, I know you mentioned the office of the vice president, right?
Well,
just in 1 minute.
That's in terms of coordination. Now we have to look at the basic infrastructures, the IT infrastructures, the brainwares, the softwares that we want to use. We have to look at the capacities. How many of these capacities do we have? We have already built the capacity over time in NASCO. We already have this register. We are now updating it. It's not that we are starting from ground zero. Turn to my mentor, Mariam Weiss, who is in the house. She started this thing with, and then along the line, Dr. Bindir too joined. These are people that have contributed eminently to the social protection and social safety net sector in Nigeria. So what I'm saying is for us to have the IT infrastructures, to have the necessary softwares, the capacities, to push this thing, and then the political will is very important.
All right. Political will, capacity, the infrastructure, and okay. Of course, we really have a ministry that is coordinating. It's just to ensure that their capacity is actually built, and then we have the right infrastructure to help us harness that. Okay, I know we've already exhausted our time. I think probably can just sit or go down. Okay, because we need to have a breakout. We're all here to contribute to the conversation so that we can hear from the experts who are also in the room.
I have a plan to catch.
But we all need to, co-create that conversation. How are you? Thank you. Basically 20 minutes?
20 minutes.
Yeah.
Have a plan to catch. Great. So I think we're going to transition immediately into discussion, our workshop to discuss the implementation of an effective social safety net, right? This time we need everybody to, we need your attention. We want you to contribute so that we can co-create, consider a couple of factors that we should put into consideration when designing or implementing an effective social safety net. So how we're going to do this, because of our numbers and where we are, right? I think that we can do it collectively. We're going to, discuss a couple of factors that we should have conversation around and open it up so that everybody could actually contribute to, to the plan, to designing the implementation plan for an effective social safety net. So to start off, what I would recommend is for us to put couple of things into different buckets, then we'll invite people, individuals to contribute, chat, come up with your initiative on how to address that. So we're going to have someone that is going to help us to take the notes. So starting off, I think there are a couple of, just to take you through the buckets that I'm thinking, right? So if you think about different other ways that we should consider this, also you're free to chime in, right? So one, I think we should look at the implementation plan, starting from what is the precondition of the things that we should consider. What are the things we need to consider? You know, you could piggyback on some of the points that came out from the conversation, the panel conversation, or also you could piggyback on the presentation I made. What are the things we should consider, prerequisite conditions when designing or implementing a social safety net? We put it so that we can dive into all of that. So the second one is the resource requirement. The third one is supporting partners. Who are the stakeholders we should consider? And the final one is that how can we consider, what are the potential factors that could hinder adoption? So that is very important as well. So starting off, I think we should start with what are the preconditions that we should consider when designing an implementation plan or designing a social and effective social safety net?
Thank you very much. My name is Anna. And this is my answer. Actually, this answer kind of touches the first factor that you touched on the last. I don't know that there's any proper plan for safety nets because we're also thinking about strengthening the rule of law and system. So that is the most efficient and most concrete way to hear the people. Access to justice, access to a system that ensures that there's accountability in a way that is tangible and meaningful to the people. So in these conversations, we must also carry along the justice sector, how we strengthen that department in a way that allows it to function properly. Thank you.
So when we talk about social protection, I think we get problem. And I know we know what we get problem with. Every student of public policy knows that. There's no one answer. There's no silver bullets. It's complex. It's complicated. Number one, we are not providing social security. We are basically not obeying our Constitution Section 17, which talks about welfare, about well-being, and equality and social justice for the citizens. So basically, we refuse to do that. Two, the federal government is doing too much about social security. I do not think that the federal government should do more than lead that policy. Federal government should not be sending money to anybody. They can send money to states or to institutions around the local government, not even the states, that will anchor the distribution, whatever it is. It shouldn't sit on money. Three, even the register should not be in Abuja. Abuja can have the numbers coming from the states, but Abuja should not be the owner of the register and then give to other people. Three, since 2027, or 3 or 4, since 2016, we've had like 27 safety net programs in Nigeria running concurrently or not running concurrently. And in all of those instances, about 25 to 30% of the budget is used for operations. So what's happening? So which safety net are we talking about? Three, we are talking about 4 or 5. We're talking about 1 million Nigerians are poorest of the poor. Let's put it that way. Which means, according to Good World Bank standard, they are living $2.15 below per day. If you live more than that, that's about 4 million Nigerians. That's 24% or thereabouts. They earn more than $3 or something dollars per day. They spend more than $3 per day. So there is a problem. We cannot, for instance, look at what Grab did, 2.1 million in as how many years? 21 to
10 years.
Too much. 10 years. It's too quick. No. That doesn't work for us. We cannot right now be reaching 6.1 million households like we are doing in Nigeria, or plan to reach 40 million when we have 71 million poor. This forest of the poor, multi-dimensional is 1.133 million. 71 million is forest of the poor, those who stay hungry like we saw in the video and the rest. So we need to do more. And I do not think that we have not over-politicized the issue of safety nets. So if you look at those registers we are talking about or we are granting about, and look at political timelines, it has to be political party members from one particular point in time when it was being compiled or when it was not being compiled. There is a serious problem that we need to. So there is need for us to sit back and decide what do we want to do. and then begin to develop that. It is a national thing. Because we have to deal with the governance of it, the policy part of it, and concretely its implementation, the operational and implementation part.
All right.
Good afternoon. My name is Chinny from England. And I'll line with the points made already, but I'll add to this. Right? One is that every program or structure needs to be localized.
Localized, yeah.
Decentralized away from the center. Right? And whatever foreign interests are trying to implement projects or programs, like you said, right? The lot spent on operations, that money should be redirected towards more beneficial structure, right? And those foreign entities can just do a monetary evaluation of whether it is required. The program should not be stigmatized, right? It should remove every stigma away from foreign support. So they don't see themselves helpless. They don't see themselves as being coerced or being manipulated in any way. There's a need for credible and great institutions, right? And the role of law should be helpful in this case to ensure that these are such. And then we need to translate from consumption to production. The program shouldn't just be, like I said earlier, it shouldn't just be to feed them or to keep them alive. It should be to empower them and to transition them to being more productive. Thank you.
Great.
We legal practitioner, also a student of program development. First of all, I would like to say that the program should be rights-based, not privilege-based. The social safety net we have in Nigeria is privilege-based. It's not right-based. So you see that we have an issue of participation. We see that we have issue of forcing the government through a legal process of the judicial system for them to render this social service to the people. Now you see, we also have the issue of the system being politicized. As it was rightly stated, it was during electionary period that they came up with the system. I know from my local government, I know so many people that were selected based on the party they belong. And you see, most of these people are not supposed to be beneficiaries of the program because they cannot be defined as poor people. Also, we need to define poverty within the context of the peculiarity of Nigeria because poverty is relative. So if we must address this, poverty has to be defined specifically within our context. Second is an institution. Now we should build an institution that runs on its own systematically, like what we experienced when the Minister of Humanitarian was suspended for a whole year. The institution was totally down. No program was implemented by NCPA.
All right.
And also, the last of just aggravation. Let's find a way of giving a time frame that this social set of beneficiary within a time frame will be graduated so that we won't see
Time for graduation, yeah. Yeah, that is fantastic. Now let's get into the resource requirement. What are the things that we need to run an effective social safety net? There's a whole lot that we have said that also intersects with this point. So if we can get 1, 2, 3, so we can capture that resource requirement for an effective social safety net.
Nigeria, how much we're dedicating? We're dedicating just 1.1 billion of billion of percent of our resources to social safety net now. South Africa and Kenya, 2.1%. So that's a big number.
Budget allocation. 10 minutes.
And private sector and also the government. But then we need to get the federal government just to sit back and allow people operate contributions. Just coordinate all those things. Big companies will add to it. We should have kitchens in Abuja, for instance. There are too many poor people who find it difficult to survive. We should have people who provide at least one 1 million a day or something, maybe only weekends. It should be part of it, not just the other day. I was on a different program. Somebody said sometimes they don't need the money, so we buy food for them. No. They're supposed to transfer money. Transfer money. I encourage others to do that. In churches can say, okay, if you come to church, you get food or something. Most can say, after prayer, there will be food for everybody. It's all part of social security net. So let's not.
All right. Because of time, so first is that budget allocation. We need to find a way to increase the budget allocation. Also, corporate contributions. It's not just, it shouldn't be a government affair, right? Corporate, private sector should also contribute to the safety net, right? Safety programs. You also mentioned, I think somebody, I don't know, from our point around the registry, we need a comprehensive data to lean on, right? I think that is also a resources that we need to get this thing done. So let's quickly get into the part of stakeholders mapping, right? You wanted to say something about stakeholders. Who should be part of? Okay, go ahead.
I just last thing, right? The U.S. government has a target of 0.7% to go towards foreign direct investment, right? And that could be, we need to have a discussion within the national government, what percentage of the budget should go towards that, and it should be legislated. That's my point on that. But on the stakeholders, we've talked about different stakeholders that can be involved to contribute towards this effort. We have stakeholders such as the high net individuals, right? We have stakeholders such as the Christian organizations, churches, mosques, and civil society organizations that have access to certain resources that can be pulled together and serve as a resource pool to coordinate such efforts. Thank you.
Great. Do we have any other stakeholder that we may have missed? Great. So let's get into the second to the last, barriers to adoption, right? What are those things, what are those potential factors that you see that could prevent, you could have a fantastic design, a fantastic program on paper, but implementation or adoption becomes a problem. What are those potential factors that you see that could, prevent adoption or ensuring that the program is successful?
Good afternoon. My name is Mariam, and it's not to manage. One of the things that will be hugest barrier, I think, in our country is politics. We must depoliticize poverty regulation, empowerment, because everybody deserves, especially those who don't have access, deserve support. And I say this from experience. I'm surprised that the gentleman had said in his local government, the social register is not a national social register. It's a state social register. The people that actually enumerate are at state level. They are the ones that conduct the enumeration, the community engagement. We have, from my past, we have people that were trained in the wards to actually visit the beneficiaries every week, hold their hands, coach them, support them on investment, on savings, on how to apply the funds. These were actually local government staff that were trained to do that. Now, when the data is collated, it's cleaned and sent to the national so that there is one database, but the information is collected from the local government, from the community. So it's a state register. And this thing began even before the Buhari administration. It began under President Goodluck Jonathan. There's a gentleman called Peter Parker who was taken by the World Bank, and he started all the screening in 8 states. That's when the social register actually began. And I agree that it's difficult for the Ministry of Humanitarian to actually
coordinate.
All of the state registers are cited in the ministries for budgets in the states. It's used, or ideally should be used, as a planning tool. So I would suggest that it should be in the Ministry for Budget and Planning, so that we have a better sense of how to plan. And using all the measurements, how many dollars, all of that is not quite contextual in our own context. It's about multidimensional budgeting. There are many things that affect not just income and monetary. There are many things that actually hinder and are barriers to people being raised out of poverty. What we lack also is monitoring systems to ensure that those that have been supported are monitored closely to ensure that they have livelihoods and they can be raised out of poverty. We need to also clean the register consistently so that we know, at least periodically, so that we know when people fall out and when people fall in, because this happens again and again. Now, what we have seen with the politics is that it's used as, they have an endemic culture of slots and people from it's very hard, especially at local government level. So the more we use civil society, third-party monitors, to actually witness what is going on and report back, the easier it will be. It won't be an easy to stop overnight. I think we need a results matrix for poverty alleviation because we have all these different sectors that should be part of the effort to reduce poverty. But the challenge is everybody is territorial, as Engineer Pinto said. So, and even within the development agencies, everybody wants to be able to report to their boss or the headquarters, or if it's an NGO. What we have done, even the private sector, what we have done with the money that we have used, if you work in a partnership, which is increasingly becoming more impactful, which is better for us because the more people working together, the more less likely it is that, it will fall through because somebody will pick up and everybody's watching one another. Once you can have this matrix that actually enables you to know this is what I've done with my money and can report back, that will really help. I think that is something we should be working on. And we also need to ensure that we don't do humanitarian work, we need to link it with development. We ensure that anybody that's been supported is also supported with skills and also with peace building. So it's like one effort, but divided into three, maybe, but let's start and then move into, and then there's a transition that ensures that these people don't become dependent.
Yeah.
They are able to take ownership of their lives.
All right. Thank you so much. You have a lot. We have limited time, unfortunately. Yes, I would like to hear from you. But just to mention some of the points to ensure that we captured it correctly. One is that politicization of social protection program is a problem. Coordination, who coordinates, where it sits. Ministry of Humanitarian Affairs may not be the suitable ministry to coordinate. Lack of monitoring system is also a problem. Siloing and territorial mindset is also a problem. I heard from what you're saying. Lack of result metrics, and so I think I will pause here. Let's hear, so I will not take much of the time.
Very critically, you speak of the socioeconomic well-trained people.
Okay.
Execute these things. Employment, the hiring, and the partnerships is very effective and run therefore. But on this barrier to success, I think we are having difficulty in this country celebrating success. We don't believe that we can do good things. Anytime you bring your back, you will realm and you connect it and you analyze and you say, this is what is happening. The next people will also, they just don't believe that this can happen in Nigeria. This is why the social register people are fighting it. People don't believe that we can actually practice this social register credit. Or, in fact, it was governments that actually was fighting the social register. A clear demonstration of total ignorance of even their state. It is the people that collected the data. They came to Abuja and proposed. So we must develop this culture of celebrating success. If people have done well, celebrate them. But every social intervention or this social protection, I have been since people Every single time there's change, they will claim that there's corruption. People who operating are bad people. They don't know what to do. They have chopped money, nonsense, all these things. So we must learn to celebrate success. Why can't we say, oh, they got it right? The social is fantastic. Then you can move forward. Otherwise, we're just in this cycle of abusing ourselves, abusing our leaders, abusing everything that is good. We are good and we have good people, and they've been very well in many cases. That celebration of success is just a narrow area that we need to.
This particular was here. I said
So can you-
the national values to experience the national position, expression and ways that is from the ground from the local government. And then it's you are now saying it's owned by the state. It means that I don't know what's going on.
You see, the whole debate on the social register started when Soludo and the governor of Colchester, they came here at the Economic Council, and they believe that every government to do with social investment should be given to the office. So the only way they can be able to do this is to say that what you're doing at federal is not safe. It is not working in our state. We don't know who is benefiting. This is all political game, just like this. So the social transition is there at the world level, the chiefs, the youth, the women leaders, the non-governmental organization are the people who actually said this house is a poor household because they have a widow, they have blind people, they have children out of school. There are many industries, over 200 of them. Then they will make. This is how, so from the community, what we're using, it goes to the local government, up to the state. So the state social register is owned by the state, it's done by the state. The federal, the national, we didn't call it federal social register, it is national. It comes also that way, because World Bank is coordinated so that we could one data and we know what is happening. Now, because people thought it is from the NSI that we send enumerators to the village to enumerate and bring the data. That is not true.
Those are some areas really must have definitely sort of key issues, right? So we don't invest a lot around monitoring information. Like most persons have said, nobody wants to hear accounting transparency on issues to look out for. Another second area is financial inclusion, right? People, of course, sometimes when some question across people, something part of operation. So people want to see accountability, pay those accounts, so you can start exploring the how. But another issue to also look at is reporting. So there's a politics within the reporting. If you see your area as more government, you attract interventions, you attract too much intensity. So there could also be those kind of issues again affecting social media stuff. But let me just say this, obviously. China that has a record of a steady creation of 7 very million reports ask themselves 3 questions. Who are the poor? Why are they poor? And what do we need? Nigeria was last conducted a census in 2006. This is let's say making 20 years of more census. You don't know who the poor people are in education, income level, educational background, nothing. And then second, why are they poor? Nowhere in the poor. What do they need? Usually contest with also what it needs to be. I don't know for the poor person and be different from what another poor person needs in Christ. Thank you.
All right, so I think we should wrap up at this point because there's still of other apologies. I guess we should continue the conversation after it. Thank you.
Thank you.